Greetings, my friends. Welcome to my program. This is Doctor Jaime Daniel, and today I want to share with you an overview of polymyalgia rheumatica and giant cell arteritis. Both are closely linked inflammatory disorders that almost always occur in people older than age 50. Polymyalgia rheumatica causes muscle pain and stiffness in the shoulders, upper arms, hip area, and sometimes the neck. The age and stiffness are usually worse in the morning or when you have not been moving for a while. They can sometimes be very debilitating and tend to improve with activity. People with polymyalgia rheumatica sometimes have another disorder called giant cell arteritis, which is associated with inflammation of arteries, especially those located on each side of the head, scalp, and the aorta, and its main branches. Headaches, scalp tenderness, and jaw pain are common features of giant cell arteritis. If the blood vessels that nourish the eyes are affected, there may be visual problems such as fleeting or permanent vision loss or double vision. It is important to seek treatment right away if you have visual symptoms, because if left untreated, they may potentially lead to permanent blindness. Giant cell arteritis is also known as temporal arteritis and Horton disease. Both disorders generally respond well to treatment, although it is common for symptoms to recur after decreasing or stopping therapy. You are more likely to get polymyalgia rheumatica and giant cell arteritis if you have certain risk factors. For example, it occurs almost exclusively in people older than age 50, typically in people in their late 60s and in their 70s. Women get these disorders more frequently than men do. They are more common in Caucasian, especially people of Northern European ancestry, but are also observed in patients of other ethnic and racial backgrounds. Polymyalgia rheumatica and giant cell arteritis are related conditions, with some people having symptoms of both. About 10% of people with polymyalgia rheumatica have giant cell arteritis, and about 50% of those with giant cell arteritis have polymyalgia rheumatica. The symptoms of polymyalgia rheumatica can include pain and stiffness in shoulders, neck, upper arms, and hip areas. The pain and stiffness are usually worse upon walking in the morning or after resting, and usually last an hour or more. You may have difficulty with activities like getting up from bed or a chair, and dressing and brushing hair. It is also typically to have difficulty raising your arms above the shoulders. Flu-like symptoms including low-grade fever, weakness, loss of appetite and weight loss, occasional swelling of the wrist or joints in the hands. The symptoms of polymyalgia rheumatica can come on quickly, usually in a matter of a few days, and in some cases even overnight. The symptoms of giant cell arteritis can include headaches and scalp tenderness. These are the most common symptoms. The headache pain may be severe and is usually located in the temple areas. Some people notice tenderness of the scalp often prior to the onset of headaches. Jaw pain. People sometimes experience jaw pain, especially when chewing. Visual disturbances. Many people have episodes of double vision or vision loss in one or both eyes. At first, the visual disturbances may last only a few minutes and resolve on their own. It is important to see a healthcare provider right away if you develop visual symptoms, because if left untreated, they can lead to permanent vision loss within hours or days. Flu-like symptoms, these include low-grade fever, weaknesses, loss of appetite, and weight loss. Large artery involvement, including inflammation of the aorta and its major branches, can lead to bulging of the artery, known as aneurysms, or due to blockage of the artery, cause cramping or aching pain in the arms or legs with activity. At times, inflammation of the aorta does not cause any symptoms, but it detected by chance on imaging studies, such as a computed tomography or magnetic resonance imaging. In most people, symptoms of giant cell arteritis develop over the course of weeks or months, but in some cases, the onset is more abrupt. Some people may have only large artery involvement, such as the aorta, and not have any symptoms in the head or scalp. These people may experience flu-like symptoms or no symptoms at all. Inflammation causes polymyalgia rheumatica and giant cell arteritis, but scientists do not know what triggers it. Some studies have linked certain gene variants with the disorders, but these genetic links have not been consistent across different populations. Because the disorders occur in older people, the aging processes may contribute to the disease onset. The primary goal of treatment for polymyalgia rheumatica is relief of symptoms. For giant cell arteritis, the aim is to alleviate symptoms and to prevent vision loss and other potential complications. Polymyalgia rheumatica and giant cell arteritis are primarily treated with corticosteroids. There are other medications that you can be prescribed by your doctor, like disease-modifying anti-rheumatic drugs, also biologic response modifiers. Remember, osteoporosis is a condition characterized by weak and brittle bones and can be a complication of taking corticosteroids, so your doctor may also prescribe medications to strengthen the bones. Living with polymyalgia rheumatica and giant cell arteritis requires you to be aware that corticosteroids can cause side effects even at low doses, and it is important to let your doctor know if you experience any symptoms like heightened risk of infections, mood swings, insomnia, high blood pressure, vision problems, diabetes, osteoporosis, weight gain, swelling of face, legs, or other parts of the body, loss of muscles, and if you notice some of these signs, please ask your doctor to do some adjustment for your corticosteroid dose. For example, you will do it to protect your bones. Make sure you get enough calcium and vitamin D and do weight-bearing exercises such as walking. And to avoid weight gain and lower the risk of diabetes and high blood pressure, eat a healthy, balanced diet and exercise regularly. If you smoke, see your doctor about making a plan to quit. Smoking can affect bone and heart health. It is also important to visit your health care provider regularly and follow their recommendations. Talk to your doctor before beginning an exercise program. He or she may refer you to a physical therapist who can develop a plan to help you be more active and manage pain. Talk to a mental health professional or join a support group if you develop anxiety or depression. Living with polymyalgia rheumatica or giant cell arteritis may be challenging at times, and sharing your experience with others may help them. Well, I hope you enjoyed this episode, and we will see in the next one. Thank you.